Welcome back. This morning, the American Lung Association released its annual State of Lung Cancer report and broke down the data by state. Oklahoma, in every category, ranked in the bottom or below average tiers. So joining us live to discuss that report is Charlie Gagan, the advocacy director at the association. Charlie, good morning. Thanks so much for waking up with us.
Good morning. Thank you for having me.
So based on this report, Oklahoma obviously it doesn't look like it's doing very well in fighting lung cancer. What area would you say Oklahoma should focus on to get the state back on the right track?
Sure. So this report shows that the lung cancer survival rate has increased about 13% over the past 5 years, in part due to early screening diagnosis. And so that is one area we would really like to see Oklahoma focus more on, is helping to screen lung cancer early so it can be caught and it's likely more curable and treatable when the earlier it's caught.
So some of the racial disparities noted in that report, indigenous peoples in Oklahoma have a significantly higher rate of new lung cancer cases than the national average of indigenous peoples and much higher than white people in Oklahoma, and that black Americans in Oklahoma are the least likely to be diagnosed early. So what is contributing to these racial disparities and how can they be rectified?
Well, there are several factors. Smoking rates is one. Another big one is really access to care. And so that's why we are incredibly optimistic that Oklahoma will soon expand Medicaid, and that will enable up to 200,000 more Oklahomans to have access to lung cancer screenings if they qualify or are concerned.
So what can viewers at home do to keep themselves and their families healthy? We know everything right now is coronavirus, 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 but there are other health issues out there that are very detrimental to people.
That's right. So this year, more than 3,200 Oklahomans will be diagnosed with lung cancer, and there are a variety of risk factors associated with that. Obviously, one is smoking and secondhand smoke, but also radon gas exposure and air pollution. And so we'd really like to see the state of Oklahoma address this with a comprehensive smoke-free indoor air law, tobacco tax increases, and robust quitting and cessation programs. We were heartened to see State Question 814 defeated, and that will enable TSET, one of the state's unique health agencies, to continue its fight by providing cessation and quit line programs.
Yeah, and how important was that state question for you all? Were you monitoring it throughout the whole time?
We definitely were. You know, TSET in Oklahoma is a unique institution. Very few states protect their money the way Oklahoma does. And so we thought that was a critical ballot measure to ensure Oklahoma can continue to have the resources to fight not only tobacco, but all sorts of other health problems.
All right, Charlie Gagan with the American Lung Cancer Association. Thank you so much for waking up with us. We appreciate it.
Hey, thank you. Have a great day.